Heart failure is a condition in which the heart is unable to adequately pump blood to the rest of the body. If left untreated, this can result in progressive worsening of the heart's pump function, multiple symptoms, and in late stages can result in multi-organ dysfunction. So heart failure affects about 5 million persons in the United States, is responsible for more than 1 million hospital admissions every year, and also among Medicare patients, it's the top reason for hospital admissions. One of the common things or one of the common symptoms of heart failure is difficulty breathing. And this can pose a challenge in the emergency room, as multiple other things can also cause difficulty breathing, including lung issues, as well as the ongoing pandemic with COVID-19. So inpatients will come to the emergency room who are suspected to have heart failure. They would usually have an ECG performed and a blood test called an NT-proBNP. So an ECG, also known as an electro-cardiogram, is a 10-second recording of the heart's electrical activity. The ECG and the NT-proBNP have the highest recommendations from the American College of Cardiology and the American Heart Association in their guidelines in diagnosing patients who have heart failure. So in addition to the ECG and the NT-proBNP, sometimes additional diagnostic tests are needed to either support the diagnosis of heart failure or rule out other conditions that might present looking like heart failure. I should mention that the echocardiogram, which is an ultrasound of the heart to evaluate the heart's pump function, is the gold standard test for evaluating cardiac function. However, this test takes time to perform, requires skilled personnel, and needs to be read by a specialist to interpret the results. It takes time to perform, and it's not feasible to obtain an echocardiogram quickly in the emergency room setting. This is the reason why we developed this study to see if we can use an ECG-based artificial intelligence tool to quickly identify cardiac dysfunction in patients who do not have an echocardiogram, or an echocardiogram is not easily accessible or not available or not indicated to identify high-risk cardiac patients. A group of physicians and researchers at Mayo Clinic developed a tool using an ECG in order to evaluate cardiac dysfunction in patients. So we evaluated 1,606 patients who came to the emergency room at all Mayo Clinic sites, including the Mayo Clinic Health System, who had a primary complaint of difficulty breathing. And what we found was that this ECG-based artificial intelligence tool was able to identify those who had cardiac dysfunction effectively. We compared this to a blood test, which is considered the current standard of care to help distinguish cardiac or non-cardiac causes of difficulty breathing, also known as the NT-proBNP. And we found out that the AI tool performed better than NT-proBNP in identifying cardiac dysfunction. So our hope is that identifying these high-risk patients earlier and quicker in the emergency room will provide an opportunity to link them early to cardiovascular care and reduce associated morbidity and mortality from heart failure. So our findings are even more relevant now given the ongoing COVID-19 pandemic. We are seeing more patients coming into the emergency room with difficulty breathing, and it becomes challenging to find out what is going on. Patients with COVID-19 can also have heart failure. This can be as a result of exacerbation of underlying cardiac dysfunction or development of new cardiac dysfunction as a result of COVID. However, the reasons remain unclear. But identifying those of them with cardiac dysfunction will help better guide the therapies and the management that we provide to these patients. So I believe that artificial intelligence has the potential to revolutionize the way we provide care to patients. It has the ability to make us more effective at our jobs. It has the ability to identify things quicker, and subtle changes in patients or in tests that might not be visible to the naked eye. So I believe that on the long term, artificial intelligence is something that will be incorporated into healthcare and give us the ability to provide excellent, better care to our patients.